Hey guys, I just wanted to come on here and talk to you a little bit today about inflammation and how it contributes to heart health. So, inflammation is a lesser known but major contributor to heart conditions. Chronic inflammation can develop as a response to long-term exposure to environmental conditions like toxins, pollution, cigarette smoke, and internal conditions as well, such as free radicals, oxidative stress, excess fatty tissue, especially around the midsection of the body, and a buildup of toxins inside the body as well. Chronic inflammation plays a pivotal role in the development of atherosclerosis, which is a stiffening and hardening of the blood vessels of the body and a buildup of plaque inside of our veins and arteries. And when pieces of that plaque breaks off from our blood vessels, it can cause blockages inside our arteries. And this can prevent blood flow, and the main result is heart attack and stroke. Have you heard of C-reactive protein? So when your body is experiencing inflammation, your liver makes C-reactive protein, or CRP. Low levels of CRP may imply subtle chronic inflammation, indicating unhealthy changes of the walls of our blood vessels. Among individuals with normal blood vessel or blood cholesterol levels, people that have high or an increased risk of CRP have an exponential increased risk of heart problems compared to people with low or normal levels of CRP. So medium or high levels of CRP indicate drastic increased risk of heart disease or heart attack or stroke. There is a test that can be done to check your CRP levels. It's a simple blood test, and it helps to determine the risk of future heart attack and stroke, especially people that have had previous heart attack and stroke. If you have elevated levels of CRP in the body, you are at an increased risk of having a second heart attack or stroke, or third. So this simple non-routine blood test isn't normally done because doctors used to think it wouldn't really make a difference in treatment. But it is a very simple blood test, and since you can have normal cholesterol levels and have elevated CRP levels, it is very worthwhile testing. So you can ask your doctor to check your CRP levels. There are some inflammatory conditions that increase our risk of heart disease or heart conditions, and that includes high cholesterol, high blood pressure, of course, but also things like gum disease, gout, fatty liver disease, asthma, gestational diabetes or diabetes, thyroid disease, osteoporosis, sleep apnea, and arthritis. So what can we do if you have these inflammatory conditions? Is everything gone out the window? No, of course, hope is not lost. You can still use nutrition and lifestyle habit change to reduce your inflammation and therefore your risk of heart attack and stroke. Reducing free radicals and oxidative stress in the body helps to reduce inflammation. So ideally try to focus on a Mediterranean style of eating and be regularly physically active. And you can learn more about how to change your nutrition and lifestyle habit change by working with me. I can help you reduce your inflammation. I will be taking just a few clients, so if you're interested in learning more about what working with me could look like, you can book a free discovery call with me where we will talk about how it would look like to work together. So click the link below this video or the link in my bio for Instagram and book your free discovery call today.